We have special lecture by Ms. Saima Wazed from the WHO Regional Director for Southeast Asia. In the special lecture, the strategic framework of mental health toward a healthier region. Thank you.
Good afternoon. Thank you so much. It is a real pleasure to be here among professionals. Firstly, I'd like to say that prior to being the regional director, I used to be a professor, a lecturer for mental health professionals. I have worked as a school psychologist, as a counselor, and really the tremendous advancement that has been made in the area of mental health, particularly with this health workforce development, has been wonderful to see in Thailand. I've worked with many professionals here in the past, working in the area of autism and neurodevelopmental disabilities, and the progress is commendable for our region. Mental health is not just a state of it's not just a mental health condition or a disease. It's a state of well-being. It is a mechanism through which people learn to cope with the stresses of life, to realize their abilities, to learn well and work well, and to contribute to the communities. Our understanding of what mental health really is has changed and evolved to becoming a component of within the entire health structure, rather than just the absence of a disease. Mental health is a universal human right to every individual, regardless of their location, their occupation, their identity, and individuals are entitled to achieve the highest attainable level of mental health and well-being. Mental health is an integral part of the Sustainable Development Goals. And the SDG framework provides all of us an opportunity to reframe mental health and make it a fundamental component of the broader global development agenda, which is extremely important because it explicitly recognized in SDG 3, but it is also incorporated within the other SDGs and that have been conceptualized to be integrated, and indivisible progress on each SDG supports one another to include mental health. Hence, the target of reducing the burden of mental health conditions is supported by the progress in the other social and economic and developmental targets of the SDGs. A two-way interaction is a significant conceptual shift, particularly, I think, for many mental health professionals. Investment in mental health has to be sustainable, and it is an investment in human capital because it is crucial for human capital for social economic development to address mental health adequately. Mental health conditions represent a significant contributor to disability globally as well as in Southeast Asia region. There's a current treatment gap between 75 to 95%. It is a major factor for social inequity. Marginalized populations are particularly at higher risk. And in short, it affects the individual, the family, and the whole of society. The cost of mental health conditions and the related consequences is projected to rise to 6 trillion globally by 2030. Currently, in 2010, a Harvard School of Public Health and World Economic Forum study said that $2.5 trillion were lost due to mental health conditions. Strengthening the human resources to support the expansion of community-based services is an investment not just to increase the specialized professionals, but also non-specialized workforce. Our region has 2.8 mental health workers per 100,000. Globally, the average is 13. So it's a significant global shortage, and particularly for our region, where we are insufficiently funded, insufficiently resourced, and that's why I want to really particularly congratulate Thailand for the second edition of the International Workforce Training Program. WHO CRO and WHO Thailand have supported the International Workforce Program, and participating countries such as Bangladesh, Bhutan, Cambodia, China, Indonesia, Maldives, Nepal, Sri Lanka, and Thailand and Vietnam have all participated. The community-based mental health services report for Southeast Asia region is also available and can be used to develop countrywide and regional programs. We need a responsive mental health system, not merely mental health services. More investment is needed at the community level and the primary healthcare level, rather than psychiatric hospital level at the tertiary level. There is a need to integrate mental health within primary healthcare. We shouldn't invest further in tertiary psychiatric hospitals. Mental health care conditions can be prevented. There is a need to strengthen countries' promotion and prevention programs and increase efforts towards suicide prevention. Determinants of mental health that can be addressed through the health system include as well as drug and alcohol use, reducing drug and alcohol use, improving school environment, and mental health at the workplace, as well as addressing the role of social media. Thailand can learn and contribute to global mental health. We hope that one day it will have a regional mental health hub, and we're in process of developing a memorandum of understanding with the Ministry of Public Health Thailand so that we can address the significant need, provide accessible evidence-based services, foster regional research collaborations and innovation, offer training and capacity building, promote awareness, reduce the stigma, and engage people with lived experience within this process. Facilitating the sharing of knowledge and experience between our countries is extremely important. As much as you have advanced mental health service and training within Thailand, many of our countries do not have that same innovation, and we hope that to utilize your knowledge and learned experience and involve people with actual lived experience in order to develop the human resource planning. And of course, these are the many resources that we have that have been developed with the help of WHO, the Paro Declaration on Universal Access to People-Centered Mental Health Care and Services, mental health conditions in WHO Southeast Asia region, mental health action plan for Southeast Asia region, validated baselines for mental health action plan, and deinstitutionalization of people with mental health disorders, and community-based mental health in Southeast Asia region. The last time I was here in Thailand, I was able to visit and engage with persons with mental health conditions who were actually benefiting from many of your community-based programs. And it is a tremendous innovative approach that enables an individual living with a mental health condition to live in society, participate in the community, and to see how much they're benefiting, not just from the psychiatric treatment, but from actual being part and parcel of the community, how much better they are in the long run. So there is no health without mental health, and what we really have to do, and what WHO hopes to do and within our Zero region, as collaborating as countries together and that with the leadership of Thailand, is to promote good governance in mental health, provide promotion and prevention programs that not just start when mental health for adults, but starting from conception, from childhood. Community-based mental health programs that are much more accessible and acceptable, that keep in mind the families, not just the individuals, to assist them. Enhance availability and equitable distribution of skilled human resources for quality mental health services. And focus especially on vulnerable groups of the population to ensure that no one is left behind. A people-centered, recovery-oriented, and human rights-based care is essential for our countries. Thank you.